Hey everyone, thanks for tuning in to Momenta on the Main Line. We're your hosts. I'm Dr. Joanna Holleran.
And I'm Dr. Ilan Green. We're here to talk about all things health, wellness, fitness, performance, and overall well-being. Hope you enjoy the show. Our guest today is a certified strength and conditioning coach and currently serves as the director of sports performance at Ascent Athlete in Garnet Valley, PA. At Ascent, he and his team work with all levels of athletes from middle school, high school, college to the pros, including up to 50 professional baseball players. He also serves as an adjunct professor at Widener University in the Doctor of Physical Therapy program and Cabrini University for undergraduate students in exercise science. In addition, he works as a fitness consultant for Altus Movement Technologies, and in 2019, he published his own research on baseball conditioning. Ladies and gentlemen, please welcome Rob Rabena.
Awesome. Thank you for having me on.
Yeah, thanks for being here. I've been excited about this for a while, and I was just telling you about it. But yeah, as we've kind of gotten further into it, we've had some strength coaches on with different, focuses, but I think having the baseball focus has always been a big passion of mine. So I appreciate you taking the time.
No problem at all. It's been good.
Yeah. So we just covered a little bit of the background. I know there's actually a lot that we didn't mention in terms of the path that brought you here, some of the internships, positions, that whole windy road that kind of brought you to where you are. What got you into strength and conditioning in the first place?
Yeah. Strength conditioning kind of happened for me. It wasn't like the plan in college as a student, as an undergrad. I went in like undecided, not knowing what to do. Tried to take a business class, couldn't get into the business class, and ended up just like taking, I was like, I guess I'll take my science class. I ended up taking exercise science and really liked the professor. And once I learned more a little bit about the field, and I was like, this is a great fit. I love fitness. I love exercise. I love sports. This seems, like I could definitely do this for a living. And, from there, that I went to Cabrini College for my undergrad and went to East Stroudsburg for my master's degree and, interned at college settings, personal training settings, group settings. I did group fitness. I worked like the front desk as an intern, checking people in, making smoothies, wiping machines down. So I learned a lot from those experiences as an undergrad student and really felt that strength conditioning was like the path for me. And that's one reason why I went to grad school was like, hey, I think I want to, I really like the teaching component too. So I was like, hey, I can be an adjunct professor and like do strength conditioning. I'm like, this seems like something I can do. And, getting into the research during grad school was fun. And, after that, while I was at East Stroudsburg, I worked with baseball and softball. That's when I did my research. And my internship was at Cressy Performance, which is like a baseball performance place. They have two locations now, one in Boston, one in Florida. So they were, tremendous mentors to me and learned a lot there. And then came back home and worked as like a part-time college strength coach, part-time somewhere else at like an ice rink. Trying to get started in the field. The strength conditioning is extremely difficult.
It's an absolute grind.
It's very tough. You have to work in jobs you don't want to do and kind of get lucky with your network and know someone. And that's how I got started at MSI was from my connections with Cressy to the ownership there, and worked at MSI for 7 years, and that we're now Ascent Athlete as of a year and a half ago. So, we service a lot of, baseball players from youth to professional. We work with a couple other athletes, a lot of volleyball players, since they're overhead athletes. I see a lot of volleyball players. And now I'm also getting into some figure skating. So I'm seeing some figure skating athletes as well, some ex-Olympians and some, junior world champions. So getting with some like high level skaters has been fun recently. And I work with the here and there football athlete, basketball athlete, soccer athlete, but obviously like our primary focus is going to be baseball. And
For sure.
So that's kind of where I'm at right now. I obviously do some teaching and some fitness consulting, which is fun. Just, keeps my mind moving, keeps it fresh.
And paying back to the profession too. I mean, we met at an NSCA conference, right? And so it's a lot of like continuing education and lifting up the profession too, which I appreciate. And back to kind of what you were saying about like working with a wide range, I find, I mean, whether it's like sports medicine or, strength and conditioning or whatever it is, like somebody may have like a specific niche population, but they also take a lot of the same approach to figuring out that information and apply it to so many different other types of people. And so I think kind of transitioning into it, we talked a little bit about some of the people that you're working with. Like what age groups are you most commonly working with right now?
So right now, in the summertime specifically, we'll see 12, 13, 14-year-olds to high school and to college players. Obviously, like professional baseball is being played right now.
Yeah, in season.
So those guys won't come back till October-ish, September timeframe. So this is very like kind of seasonal training where we'll have like summer, fall, winter, spring. And then depending on the season, it will depend on what type of athletes we're training and seeing more of or less of. Yeah. But the summertime is a very popular time for like high school, college players to really get in training while they're doing travel ball on the weekends or summer leagues for college players. So that's kind of the population that we're seeing now. And we're serving upwards. I think we have like 120 clients right now. Yeah. So we're seeing lots of people in on a day-to-day basis, which keeps it fun and exciting.
Yeah. Well, okay. So I know we talked about it a little bit before we started recording, but I think one of the reasons I was super excited to have you on is just because I think that the process that you take for evaluation and like onboarding of a client is extremely unique. And I say that like coming from, like, for example, like when you work in sports medicine, like before you're allowed to do anything, you have to do an examination and pick up information. But the way that people approach that is vastly different. And the type of information they pick up drives their approach going through working with somebody. And I've gotten to see some of the stuff that you're doing. I'm familiar with some of the stuff from like some of the mentors that you've had. But can you tell me a little bit about like what is it like? What does an evaluation look like? What kind of information are you looking? And I mean, if it's not too much, like how does that change based on the age or level of experience of the person that you're working with?
Yeah, great question. Evaluations and assessment are I guess you can say passion of mine. That's actually the class I teach at Cabrini is like, assessment and program designing. So, assessments are, I think, a very important piece to developing a exercise routine for someone. And to me, it all starts with, like when they first come in. Obviously, like I'm in the private sector, so people like are paying to come in and train and see me and see my team and the people around me. But this is pretty much what it looks like. Like they'll come in, we'll sit down with them, whether it's a younger kid, they come in with the parent, or they come in by themselves if they're a little older. And we just like kind of chat. And this starts the rapport building for me, where the athlete needs to understand that like I'm on their team and I'm in their corner to help them reach their goals. And that's a major piece for me, is that first sit down. It's like, hey man, like tell me about yourself. And the evaluation for me and the initial sit down is like talk less, listen more. And that's where I want to like learn as much as I can about them. Obviously, if they need help with, they're not very chatty, then I'll ask questions. But I just want to hear them talk and tell me about themselves. And they open up and we kind of go from there. We'll learn about their injury history, their medical history, what sports they play, what positions they play, what their sports schedule is like, if they play travel ball, if they don't, legion ball, how many days a week they're practicing. What they've done for exercise. So like, what's your exercise experience? Have you just like gone downstairs and done push-ups and pull-ups with that? Or have you gone and done conditioning training at another place or at your school or with a buddy? So I really want to learn about their exercise experience. And then from there, we'll get up and we'll start our physical assessment. So the first part is I'll do the functional movement screen, which just gives me a global sense of like how they're moving. and how they're controlling the range of motion that they have. And, I can get a good gauge as to where to start them on some squatting and deadlifting and lunging patterns, push-up patterns, which are, primary movers of our strength program. After the FMS, I'll perform some passive range of motion testing. So we'll put them on the table. We'll do like hip, IR, ER, hip abduction. We'll do an adduction drop test. We'll perform hip flexion, ankle dorsiflexion tests. We'll move to the upper body, and obviously, like, we're seeing lots of baseball players, so we get a little bit more specific with like our rib cage and our arm and our scapula here.
Oh yeah.
But we'll look at shoulder flexion, shoulder IR, shoulder ER, shoulder adduction, abduction. We'll look at like infrasternal angle, which gives us shapes of the cage. Look at how they're breathing, where air is moving. Looking at all that stuff. Which just like paints a picture for me as to like where their rib cage is, where their scapula is, and how their arm is going to function when they need to throw a baseball repeatedly at high levels as hard as they can.
Yeah. So just to kind of stop you there, because I think obviously, like, I think there's the majority of people involved in sports performance and strength and conditioning have some sort of like movement evaluation where they're looking and assessing and kind of understanding quality of movement, right? I think where you kind of go a step above and beyond is looking at so many underlying factors, but also synthesizing that information into understanding how they throw and also preventing, potential injuries in that manner. And so like when you're approaching, for example, somebody who's, kind of like that age range from like end of middle school to like early high school through college, for example, if they start training with you, what are the types of things that you're watching out for? Like things that, like, I guess, things that might kind of increase the risk for potential injury, or some of like the lowest hanging fruit in terms of things that you're kind of looking to spot through that assessment?
Yeah, great question. I would say my biggest like red flags that I'm looking for in the shoulders would be, in really no particular order, shoulder flexion, internal rotation, and external rotation. Those would be my three big ones. If you don't have internal rotation, you're going to compensate at different times during the throwing motion. All right, you're going to compensate at like when you take the ball out of the glove, when you bring the arm up overhead, that's it. Your arm goes through internal rotation there. So that could affect arm path, whether you're on time or late or stabby or long, or if you're getting more spiral arm path is kind of what we want to see. The other time that internal rotation could affect the throw is at ball release. So when you let go of the baseball, right, your arm has to internally rotate to, slow down your arm effectively. So if you don't have internal rotation at that spot, you're going to see the humerus glide up in the socket. You're going to see the scapula anteriorly tilt. All sorts of problems could arise from that as well. That internal rotation piece is huge. And then external rotation, obviously, like, to throw hard, you need to have external rotation. You need to have layback. And, we've had a lot of throwers that come in and they're like, yeah, my velocity is just like not where it needs to be. And we test their external rotation and it's like 85, 90 degrees passively. And, good throwers at high levels are, upwards of 100, 110, 120 range. And, there might be on more of the looser side, but, the looser external rotation allows them to lay back effectively and spend lots of time in that layback phase, which allows them to create that whippy effect when they let go of the baseball.
Right.
So that's where that external rotation piece is vital.
Quick question just about, kind of internal and external rotation. Because I know, especially when you're evaluating like a thrower's shoulder, I mean, context in terms of like time of year and how much they've been throwing can change their overall range of motion. But then there's also this whole conversation about GERD, or like glenohumeral internal rotation deficit, and being able to accurately assess external and internal rotation. And so I guess just to preface it, it's like there's this window that shifts in terms of range of motion. So a shoulder has like a certain amount of range of motion from internal to external and vice versa. As like a thrower, they develop a little bit more of like a retroversion in the shoulder, which creates an opportunity to have more external rotation. So when it comes to, for example, like measuring internal rotation and finding whether there's a deficit with that kind of like retro version in the glenohumeral joint, like how do you assess to make sure that like what you're seeing as a limitation is a limitation? And then what are some of the underlying factors that you think limits internal rotation there?
Yeah. So when it comes to the like shift of the arc, I want to see the right IR plus ER to be the same as the left arm. Okay. So if my right internal rotation is 50 and my external rotation is 100, my total motion on my right side is 150. Right. And if my left arm is, whatever, 70 IR, but 80 or 90 ER, my total motion is within 10, 15 degrees, even though the arc is different. And that's kind of what we want to look for in throwers. And some of that is based on some research by Mike Reinold, who talks a lot about like total motion. And I think that's like very spot on, especially if you work with throwers all day long. And I think that's one thing that I like to use and looking at and recognizing that, like, most throwers are going to be limited in internal rotation. It's like something that you should see. It's like kind of expected. Like I'll have throwers that come in with 0 degrees of internal rotation. Yeah. Like none. But he throws 92 and never had an arm problem. Yeah. And is going to a D1 school. So it's like, something that you have to keep an eye on, but right. Yeah. I'm not surprised when I see something like that. Right. It's like, take your assessments and like take that information, but put it in context. Like if everything looks good, you don't necessarily have to go and try to correct and fix everything. Yep. I guess with that said, you're working with a lot of guys who are throwing really hard, and they're throwing harder at younger and younger ages. And it's almost becoming like a higher prerequisite to go and play at those, higher levels, even like going to college. So I guess for the parents that are listening and, when you're talking about velocity, when you increase velocity, there's just a lot more stresses on the arm. So what are some things that people should be considering in terms of, if a kid wants to be able to go and play at a higher level, like, and they have the potential to throw hard, like what are some things that they should be having in their mindset as they approach that? Yeah. I think if you want to play baseball at a high level, varsity or college or pro, it's a sport where you have to hit training. You have to like start training earlier than you might think you need to start. Yeah. I'm not saying you start training at 9 years old, but when you're 13 or 14 years old and you really enjoy playing baseball and want to be really good, that's a great age to learn how to rotate fast, be explosive. And these are all things that are gained in like the baseball training that we offer that, I'm very heavily involved in. So my first piece would be like, start, as a freshman in high school or as an eighth grader. And that's a great like introductory age to start a structured, exercise program and a baseball training program. My second thing is just like, make sure your boxes are checked. And what I mean by boxes is like, make sure you have a good structured throwing program. Make sure you have a good structured strength and conditioning program. Make sure you have a good structured hitting program, and make sure you have good coaches in your corner that are understanding not to push you too much or, hey, go play 8 games a weekend and blow out your arm. Like, right. No, that's not what this is. Like, that's not what this is. Right. Exactly. Like we're big on development, and like, if you're not good enough for a showcase, like don't go do a showcase. You have nothing to, you have no skill to showcase. That's where you have to spend time training and getting better at your skills and throwing harder and hitting the ball further and looking the part. If you're not in physical shape, that's one thing coaches look at. It's like, oh, he doesn't look like a D1 baseball player. He looks like a D3 player because he's 5'10" and a $165. Yeah. So you have to look the part as well and make sure your nutrition and your sleep and all these extra boxes that, you can control have to be controlled. Yeah. Absolutely. Control the controllables. Like, you can't control whether a coach is going to like you, but what you can control is your training and your ability to develop. And that takes time and that takes effort and that takes work. Unfortunately, like there's only a select few that roll out of bed and throw 90 miles an hour. You know, most people need to work to throw 90 miles an hour, you know,
and some of us never will.
Yeah, and some of us might not, you know, it's very hard to do that. And, you know, some are gifted with like loose joints and like very whippy and very explosive athletes. But if you're not, you know, training to get better at the skill, you're not going to get better at playing baseball. And that's where like we can have a discussion about like multi-sport athletes.
Yeah, for sure.
Like I like multi-sport athletes to a point, because if it takes away from your time to develop the baseball skill, then you're not going to be a good baseball player. You're just going to be a good athlete.
Yeah.
And that sometimes can translate. Sometimes it's not going to translate because you waited till your junior year to stop playing basketball in the winter.
Mm-hmm.
You know what I mean? And
so this is actually, it's an interesting topic, because I think it's something that is difficult to navigate because it's situation to situation. And like, you know, I've talked to parents about it, and I work as, you know, like a chiropractor. So I try to, you know, utilize the people within my network to kind of have those conversations with them. But eventually it ends up coming to me too, because it's parents who are talking about their kids to make sure that they can, you know, get in the right, I guess, have the right resources and be able to make the right decisions. So when it comes to multi-sport athletes that decide, or they decide that they want to be able to kind of pursue one individual sport, but then there's that concern of overloading too much or not having that like, I guess like wide ranging stimulus of physical activity. And so you kind of run the risk of repetitive stress injuries and stuff. How do you help somebody to navigate that when there's a lot of factors at play? There's the amount of time commitment, there's risk of injury, and then managing like, you know, the actual programs and training processes. And then there's also like, you know, committing to one thing, unless you're like absolutely in love with it, like might get kind of boring. And so navigating away from like, you know, some of the other sports or activities that you might enjoy to focus more time on, like, how do you help parents navigate that decision?
Yeah. I mean, first of all, it's a very tough decision. And I've had this conversation with multiple athletes and parents at all different levels, as freshmen, junior, you know, sophomores, juniors, in high school. And, you know, I always say, look, like, you know, if you like playing other sports, you know, like play other sports. Just know the downsides or the cons that come with that. And I'm big like pros and cons. Just like, okay, what do we get out of doing basketball or football, basketball, and then playing baseball? Mm-hmm. What are the pros out of not doing football and basketball and just training? Mm-hmm. You know, so there comes a point in time where it's like, hey, you're already pretty athletic. You're already pretty fast. You can already pretty jump high. You just don't throw hard enough. Mm-hmm. So you should probably work on throwing harder. And you're not going to throw harder by playing football.
Right.
So I, you know, it depends on the athlete and where they're at. It's like, hey, if you're average at everything and not good at something, then that's not good. We need to be good at something. Mm-hmm. How do you be good at something? Spend more time doing that something. Whether it's being faster, getting stronger, throwing harder, you have to practice the skill of those things. Yeah. And if you just be a generalist and be good at a lot of different things, like, you know, hey, I'm the starting point guard on basketball, and, you know, I'm the outside linebacker, and I'm pretty good, but like, I'm not really, really good, but I'm pretty good. You know, I'm 5'11", you know, I'm decently sized. It's like, all right, but like, you know, you throw 82 and, you won't hit the ball 85. It's like, that's not going to get you to the level that you want to get to.
Right. And so there's some
each athlete's going to be different. Yeah.
So I guess kind of taking a step back when we talk about training for a lot of these people, because like there's a lot of crossover when it comes to like strength training. Like there's the base, the foundation, especially for like some of the younger kids of like just developing strength can be, I mean, I don't want to say simple because it's not simple. It takes a lot of work, but there's a lot of like similarities between that style of training and general strength and conditioning. But then there's the nuances to approaching training overhead athletes. And so can you tell me a little bit about like the balance of that, like foundational strength and like, you know, getting them to a place where their bodies can perform at a high level, but taking into consideration some of the things specifically to overhead populations?
Yeah, no, this is good, because I don't think most people really understand the demands of a baseball player. Yeah. And they just kind of lump them in with like, oh yeah, like you can train them like football and basketball, and
Mm-hmm.
all those athletes can do all the same exercises. Yes and no. Definitely depends on the age of the athlete, what their training age is like and what their baseball level and skill is. If you have a 14-year-old that's never worked out before and one plays football and one plays baseball, yeah, like they could probably do the same strength program and they could probably get better.
Mm-hmm.
Likewise, if you have a 21-year-old professional baseball player at AA and you have an AFL football player, it's like, yeah, they're probably not going to do the same strength program.
Right.
So it really depends on the level. The higher the level you get, the more specialized the strength conditioning program needs to be, because they are going to have a very specific goal or a very or maybe a low-hanging fruit that isn't just strength or speed or agility. Their low-hanging fruit is, lacking of hip internal rotation or lacking hip and shoulder separation when they are pitching down the mound. So it's very specific things. And, that's the strength conditioning coach's job to improve in those qualities, as well as the other I call them easy qualities because it's like just lift weights, get strong, like strength and power and all the other fun, sexy stuff. But that's where that difference really comes into play. And having to balance those things is very important. I want to share a quick story of an athlete that I just evaled. Not to give too much info about him. Long story short, he was throwing really hard, had a drop in velo, like 6 miles an hour, no injury, and has sustained the drop in velo for almost a year. And he came in and we evaled, and he had some range of motion deficits. And I asked him like, hey, what are your strength numbers on squat and bench? And he does cleans. And he's like, oh yeah, I deadlift, 475, and I front squat, 335, and I hang clean, 275. I'm like, all right. I'm like, doing those exercises and pushing strength for him maybe helped him throw hard. But now he's having diminishing returns by continuing to chase strength.
Right.
Because he's losing other qualities that he needs to have as a baseball player, especially a high-level baseball player, such as range of motion or power. He's acquired stiffness in certain areas where he doesn't move his hips well, he doesn't rotate well, his cage is very stiff, and you want to throw a baseball pretty hard, you want to hit a baseball pretty hard, you got to rotate fast. And this man has lost that because he's chased strength too much.
Right.
So,
I think that's a really good point too, because I think that, the simple mindset is that more strength equals, better performance, right? If I just get stronger, I get faster, better, whatever. But there is like a certain kind of spectrum that like human, like tissue can shift on, right? And part of that is like there's a certain amount of stiffness that's fantastic, and then there's a certain amount of stiffness that just loses that elasticity that develops power. And so being able to kind of find that and be able to kind of have some metrics like velocity that you can then correlate to some of their strength numbers to say like, are we chasing too much? And that I think is a fantastic example of why having somebody who understands the necessities or like the demands of a sport and the movements is important to have on your team so that they can help to kind of drive those factors moving through the program and address them so that you don't have those consistent like or long-term drops in velocity. When it comes to working specifically, like for example, working with overhead athletes in general, like strength exercises for, like lower body and whatnot are pretty consistent. But when it comes to like training upper body and like different considerations for exercise selection for like shoulder specific stuff or overhead pressing or, horizontal pressing, pulling, like how does that stuff change? Is there anything that you try to emphasize? Is there anything you try to stay away from?
Yeah, no, great question. I think this is where, again, like the baseball specialist kind of comes into play. So I guess we'll chat about like arm care first, before we get into some of the general movements. Like arm care needs to be in your strength conditioning program. Like that's where it needs to be. That's something that baseball players need to have. Like they need to have a quote unquote strong rotator cuff, serratus, all the muscles around the shoulder, need to be able to do their job because the sport demands it. Just like in football, you got to be fast. So you got to train speed. In baseball, you got to have a strong, healthy, mobile shoulder.
Yeah.
That's what the sport demands. So that needs to be trained. And those are qualities that are, tested in the assessment, and then you have to train them in the gym. And, just to give some basic exercises that are really easy for most people to do. Like, we're all probably familiar with kettlebells.
Yep.
Just turn it upside down, kettlebell bottoms up carry, and you just walk with it. You hold it at 90 degrees of shoulder flexion, and you're going to feel the rotator cuff working pretty good. Right. So there's lots of ways where we can train the rotator cuff that are, quote unquote, non-traditional, besides just like external rotation with your arms at the sides or some bands or anything like that. Those are okay exercises to use, but there's lots of other ways where we can train the shoulder as a high performance shoulder, if you will. So that's one thing that you have to be able to add into your strength conditioning program. And just doing like prone Ys and Ts and some bandy Rs like isn't enough. Right? The second piece is like, what exercises do we modify if we're seeing an overhead athlete is a great question. We'll start with the pressing activities. And if you think about what a baseball player does when they throw a baseball, one side of their body is doing one thing while the other side is doing the complete opposite.
Yeah.
Okay. So when you think about that, and that's what the sport is, you would probably want to train those things in the gym in addition to bilateral movements. So we'll start with just like the concept of bilateral training and single arm or single leg training. Like, you definitely have to do both, right? There's benefits of doing bilateral, there's benefits of doing single arm, single leg, whatever it might be. For example, like if someone's like generally weak, like doing bilateral training, like a horizontal row, TRX row, chest-supported row, seated cable row, like great exercise, right? When you do a standing split stance, one arm cable row with a reach, you are still developing strength. You're also incorporating a reach, which is going to help teach trunk rotation. Right. So now we're turning our rib cage, right? We're bringing the arm through internal and external rotation, which is what happens when they throw baseball. We're in a split stance, which is a common stance that throwers and hitters are in all the time, right? One leg is in hip extension, one leg is in hip flexion. We can add in like more, we can shift our hips to increase hip internal rotation. So there's lots of ways where we can like really like quote unquote get sport specific with a split stance one arm cable row, where we don't really get any of those qualities in a seated cable row. So to sum that up, like definitely do both like strength bilateral stuff, and then make sure we're doing lots of single arm, rowing. Same thing with pressing. When it comes to pressing, make sure we're doing lots of single arm pressing in addition to, bilateral pressing, right? I use a lot of landmine pressing variations, lots of one arm dumbbell pressing variations, lots of push-up variations. Okay. Don't utilize a ton of like straight barbell variations. Just found that in my experience, in my opinion, the positions that the body is in when they do a barbell bench press aren't positions that I want to have my athletes in.
It's too
when
much
they are playing. When they're playing baseball. The positions that I don't love in the barbell bench press is like max rib cage extension, scapular depression and retraction, along with like bringing the arms down to the bar, down to the chest, which could lead to like some humeral gliding through the shoulder.
Right.
When you throw baseball, you need the complete opposites of all of those things that I just named.
Yeah.
Upward rotation, protraction, and not the arm and humerus dumping forward.
Right. The anterior glide type.
The anterior gliding. So it's like, what are the pros of the barbell bench press? You get strong. Like great exercise for strength. But the cons of it, in my opinion, aren't really worth it for the population that we're seeing, specifically the older population.
Right. Yeah.
The high level high school, college pro guys, like, again, they don't need to be good at doing barbell bench press.
Right. The strength
they need
is
to be
already
good at
there.
throwing a baseball. Right. Correct.
Yeah.
So in a younger athlete, yeah, you can do some dumbbell pressing. You can do some sometimes I'll mix it like a Swiss bar, which is just a little more neutral grip and don't over cue a big puffy chest.
Yeah.
So it's just pros and cons with like choosing a lot of exercises when it comes to working with baseball players.
For sure.
But that's why I much prefer a landmine press because you still develop pressing strength, but you also get upward rotation and through the scapula, you get scapular protraction and your rib cage isn't extended. Right. One downside of the cage extension for baseball is extension is going to limit your ability to rotate.
So I was going to get into this because I think this is one of those things. I think a lot of people, honestly, I feel like I probably learned a lot of this just from Cressy and some of his courses, just talking about like shoulder mechanics and things like that in terms of, the relationship between the scapula and the humerus and how it's supposed to move, retraction, protraction, the whole thing, upward rotation. But I think that it isn't as common to understand the mechanics of the rib cage and how that influences the scapula and the humerus, right? And the positions that they're in. And so you started to talk a little bit about it in terms of like a flared or drawn down or like, kind of like rib cage down or what we call like sternum to hips or sternum to belly button type position. Can you talk a little bit about some of the things that you're looking for on that level? And then also how much you are like particular to coaching that at what age range? If that makes sense.
No, great question.
How picky you are based on the experience level. Yeah.
Yep. So let me answer that last part first. Yeah. Like I'm not doing breathing or rib cage mechanic stuff with like a kid that like can't do push-ups or like can't hinge. Yeah, exactly. Like, so I'm going to just throw a general age out there, like 15 and up. We're doing some like rib cage work and making sure we can move our rib cage. Right. But like, this is what we want to see with a rib cage and scapula and air. And pretty much we need to see our rib cage. We need to see it stacked on top of our pelvis. Picture like two dolls that like turn and rotate. They're like, I forget what they're called. The Russian dolls that like turn. That where they're both on top of each other, the top and the bottom. That's our rib cage and that's our pelvis. And we need those things to be on top of each other at most times for most activities. Right? When you go and play your sport, you're not going to think about any of that stuff. So you're going to extend. You're going to see extension in sport. We just need to manage that in our training and not do too much of it. That could lead to some lower back tightness. Again, it could definitely limit rotation. If all your training is just driving extension and, puff your chest out and arch your lower back. Again, that's advantageous to getting strong. That's good for powerlifting. That's good for deadlifting. That's good for squatting. That's good for benching. But it's not good when you need to rotate.
Right.
Because your back is going to be quote unquote on, or your extensors are going to be concentrically flexed. They're going to be on, right?
Yeah. You get a lot of facet irritation that way too.
Yeah, exactly. So, when you're really working with baseball and they need to rotate, your strength conditioning program should definitely consider that. And, what you want to see when someone breathes is how we kind of coach it and look at it. You want to see when someone inhales through the nose, you want to see certain parts of the body or certain parts of the rib cage move or quote unquote expand when someone inhales. And when they exhale, you want to see the rib cage drop down. And then when they re-inhale, you want to see certain areas expand. And, you kind of go from there. And there's different positions you can put the arms in, the legs in, where you can really gain some increase in range of motion, where you can, make the athlete feel better by providing them a, quote unquote, like breathing exercise or technique to put the body in to see increases in range of motion. So that's where we'll utilize a lot of breathing techniques or rib cage techniques as like through the warm up or throughout the exercise program to, not only see like increase in range of motion, but just like see the rib cage expand in different areas that they're not used to expanding in, which is going to lead to a better functioning scapula, arm, and overall shoulder health. Because the rib cage is the foundation of the scapula and the arm.
Right.
So if you're not doing any like rib cage work or breathing work, there's definitely some things that could be missing.
Right.
Even if you're doing like core exercises, but you're not utilizing just inhales and exhales, and they're just like doing dead bugs with their lower back either arched or they're not utilizing breath. when you do a dead bug or a pal off press or a chop and a lift,
Right.
or planks, whatever quarter exercise you're doing, then the rib cage is going to learn to be quote unquote stable in an extended position.
Mm-hmm.
And that's not what we want, especially when you play baseball.
Right.
So, there's lots of ways we can like teach that and progress that. It's first starting with like the warm up,
Mm-hmm.
and then adding layers of difficulty to it, in the exercise program. So it's a very complex idea, kind of hard to explain.
It's very difficult, especially without like graphic representation. But I guess to kind of like sum it up in terms of, I mean, okay, so like for example, when we approach a lot of care for our low back patients, the first thing that we do is we look at, I mean, like diaphragmatic breathing, but their ability to kind of like increase pressure and like become stable, right? Their ability for their core to become stable. And so I guess as it relates to the shoulder, and tell me if I'm wrong, but a lot of it is like you try to work from the center out. And so if the core is set, right, then you move up to how the rib cage is functioning. And you want to make sure that the rib cage can expand in certain places or move and kind of like incorporate a solid base in certain places so that the scapula, as it wraps around the rib cage or, rotates through, can do its job so that the shoulder can do its job. Right. And so taking it closer and closer back to the center where it's like, if somebody has an issue with the shoulder, look at the way that they're bracing, look at their rib cage, right? And being able to evaluate the rib cage function by watching the way that they breathe can be really, really helpful in terms of providing information. That's awesome. I remember I asked you like a quick question about it, like right after a talk at the conference, but it was not the time to expand on it. So I've been waiting to ask you about that, and I appreciate your answer.
Yeah. One other quick analogy real quick for the rib cage and scapula. It's like familiar, like scapular winging, everyone blames the scapula. It's like, oh, you have scapular winging, like you have weak or messed up trap muscles or lower trap muscles. And in reality, if you picture like a rib cage, it's supposed to be like slightly curved up between the shoulder blades, and you have a scapula that's also supposed to sit on that rib cage. But if your rib cage is really extended and quote unquote flat, where the scapula is winging, and just doing lower trap exercises to bring the scapula that's winging to the rib cage is like very difficult to do. Usually doesn't work. So you have to bring the rib cage back to the scapula. And that's where getting that expansion that we were talking about earlier of the rib cage in certain areas of the body can be very, very successful at, not only improving scapular winging, but just improving shoulder health.
Yeah. Yeah, that makes sense. I guess as like an analogy, and tell me if this is a bad one, but if it's like, the table is like kind of shifting or offset, maybe it's not the table, maybe it's the floor is a little funky.
Right. No. Yeah. Correct.
Yeah. I guess I only say that too, because we have some some funky floors here too. But so I guess kind of taking it back to some of the so we talked a little bit about like throwing program. We talked about like, shoulder health and shoulder routine, arm care routines, and some of the things to consider with that. When it comes to throwing programs, and I'm curious to ask, because I actually haven't looked into this in a little while. Last time that I was looking into it, I know weighted ball programs, for example, were pretty popular. And I know that it can be, and I use that as an example, because it's like, it can be a really helpful tool. And sometimes it's really trendy to kind of hop on these things because they can be really impactful in terms of gaining velocity and range of motion and all that kind of stuff. But whenever you find something like that, it's important to implement it properly. Are there things right now that you're seeing in terms of trends? It could be weighted ball programs or something else, but trends that are picking up that people should kind of exercise some caution or kind of reach out to somebody to make sure that they're doing things properly if they're chasing that type of competitive advantage?
Yeah, I mean, the weighted ball topic is a great one because they were popular in the 80s a little bit. Nolan Ryan was doing it, Tom House. And then like the 90s, they kind of went away and then they kind of came back. Drivelines very popularized them. And I think a lot of people ran into some issues when like Driveline was having lots of success, and it's like, oh, just do weighted balls,
right?
Like throw balls into a wall, and that's all you got to do. Plyo-care balls are like these soft, squishy balls that they just like throw into a wall, and you see a lot of baseball players warming up in bullpens or whatever it is, and then I think like coaches really learned how to like do them properly.
Mm-hmm.
And I would just caution that, like, if you're going to do weighted balls, like obviously make sure you're with a qualified coach that is trained in them and knows how to program appropriately. And we have athletes that like don't utilize weighted balls, and that's totally okay.
Mm-hmm.
But there are definitely benefits to doing weighted balls, not only to like help improve mechanics, but also to help improve velocity. And then, sometimes they can benefit to help improve location. If you get used to throwing a lot of different implements at a square area catch net, and then you go back to throwing a 5-ounce ball, it's like very easier to throw the 5-ounce ball in the catch net because you've gotten used to throwing a football or a 8-ounce ball, a 3-ounce ball, 4-ounce ball into one area. So your motor skill is a lot easier to throw strikes, if you will. So
gotcha.
Yeah, I think there's a lot of benefits. I would just recommend that they're with a qualified pitching coach to be able to do it properly. But yeah, baseball and fitness are loaded with trends. Like, there's lots of things out there in fitness, that not that like caution, but you just have to like make sure it makes sense. I think right now, I don't know, you're seeing, like, I'm seeing a lot of like water bag training. It's like, okay, like what does that do? Like, are we improving any fitness qualities with that? Like, does the biomechanics make sense? Does the physiology make sense? Like, if we're doing an exercise, like, can we track it? Are we getting better at it? How do we know we're getting better at it?
And
you just have to be a scientist and just ask questions. Yeah.
And like asking yourself, it's like, it may be, fun and different and unique, but is substituting that for something else more beneficial, right? Then
correct.
So on the topic of like training focuses right now, so we're recording on a Wednesday. This will come out on Friday, and it's kids pretty much just got out for summer earlier month, right? What are some of the things that, obviously the pros are in season right now, but a lot of other people are in the off season and they're headed into travel ball, then fall ball and all that kind of stuff. What are some of the focuses that you take for the players that you're working with right now who are in the off season, but looking to kind of get better?
Yeah, great question. So we'll throw out the high school athlete right now. Like, they train a lot in the off season. So the transitioning is like 5-6 days a week from, just call it November to February. Right. And then from March to just say June 1st, they play lots of baseball, 25, 30 games, and, call it whatever, March, April, May, 3 months. So they're playing baseball 5-6 days a week for 3 months. That doesn't leave a lot of time for transitioning. Once or twice a week, if that. Right. So when they're done their high school season, they have more time and their baseball is less. So they're able to increase their transitioning days to 3 to 4 days a week, something like that. Most high school players are usually either not playing any baseball or playing baseball on the weekends with like 1 or 2 practices a week. So their summer workout schedule is about increasing their days because they lost a lot of fitness qualities through the season. Hopefully they maintained them.
Yeah, fingers crossed.
Most lost it. Most baseball players come in, they lost a lot of weight, they lost a lot of strength, they lost a lot of power, they lost a lot of range of motion. Research shows when you throw baseball, you lose internal rotation, you lose flexion. So you have to do exercises to get that range of motion back. Making sure your tissues are feeling good. So like a lot of guys will do lots of massage, cupping, Theraguns, foam rollers, a lot of feel good stuff throughout the summer as they're like kind of playing in the middle of their season, if you will. So I would say we're focusing on a lot of those things, strength and power and speed, and maintaining those qualities throughout the summer and then through the fall. And then those guys kind of take a week or two, and then we ramp back up for the winter.
Gotcha. That makes sense. And I'm curious too, not to like totally switch gears, but I know you also work in conjunction with a lot of like healthcare providers. And I know that some of the folks who listen to the podcast are, sports med providers, whether they're chiropractors or physical therapists or, even other like strength coaches that work in like more interdisciplinary settings. Like what kind of role does that play in like working with athletes of all these ages? Like, and do you have any recommendations for anybody who is looking to kind of like make those connections and kind of start that conversation?
Yeah. Yeah, no, I mean, I'm very lucky and love working with healthcare professionals. They are a vital part of an athlete's team. And that's what I try to explain to athletes is like, hey, like make sure you have your team of, chiro PT, strength coaches, some even like will add some RDs or, sports psych professionals, pitching coaches, hitting coaches.
Yeah.
Athletes are going to have multiple coaches throughout their careers. You're not going to be like their guy their entire career for the most part. They're going to work with their school strength coach or their school's PT or their school's athletic trainer or their pro team strength coach, their pro team's PT, chiro, whatever it might be. So, just like understanding where you fit in that athlete's life is very important, and understanding like your lane. Like, I don't do chiropractor, I don't do physical therapy, I don't do pitching coach.
Yeah.
I'm not either of those. I understand a little bit about those.
Right.
I understand when to refer to those professionals to help that athlete out as much as possible. And at the end of the day, the athlete's going to like you for that, and they're going to appreciate, if the athlete comes in and they have shoulder pain, it's like, all right, let's modify your exercise program, but you need to see a healthcare professional. So it's understanding and like, if you want to call it like your quarterback role, whatever you want to call it, just like being able to navigate that athlete through that time and help them, I think is a vital part of what the strength coach does that is often, kind of overlooked. It's just like, oh, the strength coach, like, just go lift weights with them and they'll get you strong, but it's like understanding where that athlete is in their time, and having healthcare professionals in your corner is just, a great thing to have, and definitely recommend if you are a strength coach or if you are a healthcare professional and you're trying to do fitness stuff. It's like, what are you doing? Refer to a fitness professional.
Right.
You know what I mean? So the coin can
role.
flip. Yeah, exactly. And I think if you know your role and you work together with those professionals, like good things happen. Athletes love it, and I understand like my limitations and what I can do and how I can help people. And, if I can't help someone, I'm going to send them to someone that can help them.
And you mentioned it earlier too, but having like a good understanding, like even if we don't do certain things, understanding what they do just helps to make the conversation so much easier. And that way, I mean, it also makes it clear when, you're able to provide that resource for them and just say, hey, like, I know a bit about it, but this person knows a lot about it. Go see this person, and it just makes for a seamless transition, which is always great. It always benefits the person you work with. Right.
Absolutely.
In that sense, I guess, in terms of people who are looking to, like, if they have an interest in working with overhead athletes, are there any specific resources, be it like textbooks, courses, events, things like that you would recommend them looking into?
Yeah, it's a very niched job and career. So honestly, like there's not you might find like a book or two, but like the best way to go about this is like go watch or observe what say what I do or what any other, like there's lots of other good like baseball strength coaches in this area and other areas that are doing really good things. Just go and watch for like a couple hours, and like most strength coaches that I know are like very open to helping others and sharing knowledge, and no secrets here. Like come on in and watch. Like, you want to watch the eval that I do that you talked about earlier, like come in and watch it. That's the best way to like learn, and then you make connections, and you'll know like when that person's hiring and they're like, oh yeah, I ran into this guy, he came and observed, he was really good, like go hire that person. So it's good for networking, and it's good for gaining knowledge, and strength conditioning and chiropractor and physical therapy, like those are all fields that you have to learn by doing. And just like watching videos and like reading books can like help a little bit, but being in person, watching things in person is totally different and totally better. And I would definitely recommend that, to help gain knowledge as to how to do baseball strength and conditioning. And my last bit of advice is like, don't assume that if they are at a big time college or they are at a pro team that they are doing good things.
Sometimes it's just they knew the right people.
Yes.
I guess on that note, in terms of some of the parents of players who are kind of like having these aspirations, is there anything in particular that they should look for when searching for a strength and conditioning coach that specializes in baseball training? Or, well, I guess I won't say like hitting and pitching, because that might be like a separate thing, but like when they're looking at a facility that emphasizes training for baseball and softball players.
Yeah. Honestly, the biggest thing I think is just like results,
Yeah.
right? Like, does X person get results,
Mm-hmm.
right? And then a lot of that comes from just like referrals. Like, ask your friend who is good what they do.
Mm-hmm.
They might do something cool or good, or they might not, but worth asking.
Yeah.
Or it's like, hey, where do you go 4 times a week after school for 2 hours?
Yeah.
It's like, what do you do? Well, you spend so much time there. Like, why aren't you hanging out with me?
Yeah.
So like talk to your friends and talk to your friends' parents and like, get a referral. And that's how training and at least I think exercise, baseball training is the best way to not only grow business, but also like improve your sons or daughters, performance in whatever sport there is, because especially in training, I'm sure chiropractor is the same.
Yeah.
Like, there's lots of like sketchy people out there that are like doing training that like shouldn't be doing training.
Yes.
So it's like, you find someone good, like you're gonna drive 35 minutes instead of driving 5 to the guy that's around the corner.
Right.
So like, be willing to make a sacrifice to see someone good is probably like my second thing. Is like, it's okay to drive 30 minutes like 2-3 times a week to see someone good than drive 5 minutes 2-3 times a week and see someone bad.
Right. You won't get the results.
You won't get the results, So, hey, I would love to be within 10 minutes of every person that I train, but sometimes not the case. And, I have kids that are living down the shore all summer and they drive an hour 15,
right.
3 times a week for the 10-12 week summertime. And, it's like, they want to do that because they recognize that it's better to do that than to go train at, X gym, and they don't have the culture. And that's a big thing that we preface our success on here is like our culture. And, you have poor culture and you don't have other peers helping one another and getting better, and, your gym is not going to be successful.
For sure. Yeah. No, I think that's a solid point. I think it's also, the characteristics and the habits of the people around you are bound to rub off on you. Right. And so finding a group of motivated people who have the same goal as you, just
Correct.
Communally, like you're going to do well.
Right. Like I always give this example, like, proximity principle, like surround yourself with others that have your goals in mind. Like if you want to be a high level baseball player, should probably go train where high level baseball players train. You're not going to go train at Planet Fitness where there's moms trying to lose weight, and there's nothing wrong with that.
Right.
But like, you're not around people that want to do what you want to do.
Right.
So surround yourself with others in an area or a specialty, that are doing what you want to do. If you want to go be a janitor, like go to a school and hang out with a janitor all day.
Right.
Whatever it is, like go spend time with the people or persons that you want to do, and that at the long run will pay off.
For sure. Yeah. Yeah. I think, well, we covered a ton, and that's the thing is I think I could probably pick your brain on a bunch of things, but I was actually impressed with the number of topics that we covered because I was going in, wanting to touch on literally everything that we talked about. So I sincerely appreciate it. And there's definitely some more stuff that we'll talk about, especially in future episodes, if you're ever interested in doing another.
For sure. Love to be on again. Yep.
Before we wrap up, we like to do like a lightning round of fun questions. We call it a lightning round, but it's actually never really been quick. So if you have like a longer answer, then
quick.
I'll keep it quick. But yeah, we just have a couple questions. So first one, what's the most influential book you've read? It is okay if you're not a reader. I know
I read Shirley Sarman's book.
Yep.
That was
Movement Impairment Disorder.
Yes.
Yeah. I have it on my Kindle, which is not a good form to have it because
no.
Yeah. I'm curious. Was that a recommendation from the internship with? Yeah.
That was like a little bit more like PT-ish kind of book, but like, that really helped me understand like how people move and what they should be doing, and the problems that they have aren't the problems that they have.
Yeah.
Like shoulder impingement isn't shoulder impingement. There's something else going on.
Yeah. It's not your anatomy that's the problem. It's the way you're using it. Yeah. Yeah. I think that's a fantastic book. I'll link it in the show notes. Yeah, because a lot of like the humeral anterior glide syndrome, they detail the whole process, and it helps to make a lot of sense out of it, rather than just saying like, pointing to something and being like, oh, that's a dysfunction. Like it really
your
helps.
Your bicep tendonitis.
Yeah, it's like
your biceps weak. Oh, stop.
Yeah. Is there any book that you're reading right now?
I am actually not like a huge book guy.
Yeah.
But I do, like, from a book standpoint, I did get Pat Davidson's Rethinking the Big Patterns. I do have to dive into that at some point.
Yeah.
But yeah, it seems like that was got a good few recommendations on that. So I'm gonna probably dive into that sometime soon. But I'm much more like like I talked about earlier, like I love like having conversations like this. Like I learn a lot from these types of podcasts or videos or products, or just like talking to professionals. I love like that kind of learning style, where I can like ask questions and really dive in.
And I guess just on that
personally, that's how I learn.
Yeah. And well, not one of our traditional lightning round questions, but is there a particular like podcast or source that you like for some of the stuff that kind of keeps you up to date or keeps you thinking?
Mike Boyle's podcast has been around a long time, and for strength conditioning, like that's to me, that's like a great podcast. Eric Cressy's podcast is phenomenal. Those are two that I frequent a lot.
Nice. All right, next question. This one doesn't have to do with books, I promise. If you could have any meal delivered to your door tonight from anywhere in the world, what would it be?
I would say some pasta from Italy.
All right. I feel like more than half have been like pasta or pizza from Italy. That's awesome.
I love it.
Yeah. Nice. Okay. Last question. If you could go back in time and give advice to a younger version of yourself, what piece of advice would you give?
Yeah, this is something I would definitely do. I wish I could have, I guess not network, but like, I wish I would have reached out to more professionals when I was younger. And my second one is during my internships, I wish I would have spent more time with the quote unquote like business or back end of the business side of things, since I'm now working like the private sector. I was so very interested in like the nitty gritty anatomy stuff. And look, that helped me get to where I'm at today. But, that's one thing I wish I would have like spent more time learning about how to run a business and do that kind of stuff. And just like, when I was in college, like, I interned at Villanova, and like there was the basketball strength coach, and I went over one time for like a half hour. It's like, come on, I could have done better there. Just network more and be a little bit more aggressive. I was naturally like very like kind of introverted, like kind of shy, like sit back in the back and just kind of like learn and listen a lot. That was kind of like how I was as like an undergrad and grad student in first year, kind of getting started. Still I'm like that today a little bit, but
likewise.
I wish I would have like put myself out there a little more and be vulnerable and say, hey, I'm Rob, I want to learn. Like I didn't really do any of that. So I wish I would have just put myself out there, reach out to people. And now with email and Instagram and Twitter, you can just like shoot people messages and get access to anybody you want in the world. Like, my gosh, it's so easy now.
For sure. No, I think that's a solid piece of advice. And I resonate with that too. I think, always like a little bit too shy to ask questions or too shy to like, kind of get out there, pick people's brain, or I was never necessarily sure what questions to ask. And so I think if anything, just kind of showing up in certain places and being there is better, and you're bound to have questions. Right.
Yeah. Like I was even if I like attended a seminar, like I was never the type of person to like raise my hand at the end when someone asks for a question. I'm much more the guy that would like go up to someone and be like, hey, I have a question. Like, I do much better not in front of big groups. It's kind of, at the time it was, silly of me, but
well, I mean, now you're the one leading those big groups, so
yeah, I know. And I'm doing lectures and presentations, and
yeah.
I wasn't that's how the career started. I wasn't a great presenter. I wasn't a good public speaker, and now I do those things every day for a living, and I'm pretty good at them. So
yeah, nice. Well, yeah, on that note, like where can people find you? Social media, tell us all the handles and all that kind of stuff.
Yeah, Instagram, Rob Rabena 3, on Twitter as well, at Rob Rabena. Pretty somewhat active on both of those. So if you ever need any help with anything or interested in hanging out, if you're a professional on a network or if you're a parent or an athlete, I can definitely serve and help anyone with any sports, specifically baseball, obviously.
Yeah. And then, in that regard, if somebody's interested in coming to train with you, or do you guys have any programs going on or anything like that this summer? Because like I said, this is going to come out on July 1st, this coming Friday. So is there anything going on this summer or anything kind of down the pipeline that you want to give people a little?
Yeah. I'm a model all year round.
Nice.
Yeah. Our main training model is just the main service that we're offering, which is, semi-private training with individual programming.
Yeah. So no deadline to sign up, right?
Nope.
Sweet.
Come in, train whenever you want for however long you want, and we'll help you out and help you reach your goals.
Cool. And that's Ascent Athlete. I'll drop the information in the show notes too, and make sure to tag you. But
yeah, awesome.
Hey, I really appreciate it. That was a lot of fun. I really enjoyed talking to you about all this stuff, and I appreciate you taking the time to share that information. So
no problem. Thank you for having me on, and I hopefully everyone enjoyed the show.
Cool.